Good afternoon and welcome. We'll be getting started shortly, but as you settle in the chat box below, please feel free to share with us where you're coming from, either your town, your city, your state, your organization or institution. Love to know where our audience is coming from. North Texas, Virginia. Wow, it's going so fast. North Carolina, UNC, Chapel Hill, Notre Dame, New Orleans, Maryland, Tampa, New Hampshire, University of Tennessee, Ohio State, Davidson College, Milwaukee, Johns Hopkins University. Wonderful. Keep them coming. Wow, people from everywhere. This is wonderful. Hartford, Connecticut, Washington, D.C., New Hampshire, Syracuse, San Antonio, Texas. Wonderful. Ohio, Chapel Hill. Great. I just wanted to give everybody a chance to get in before we get started. All right. Well, thank you for joining us today. My name is Renee Thibode. I'm the moderator, as well as a member of the team working on the ACHF Emotional Wellbeing Tool with support from Aetna Student Health. I've been partnering with foundations, associations, corporations, nonprofits, and government agencies, strategizing and offering well-being products and programs that help individuals flourish, and I am very proud to be a member of this team. For the next hour, we'll be talking about measuring emotional well-being, taking a whole campus approach. Special thanks to Aetna Student Health for supporting today's presentation and the Foundation's work on campus well-being. Because of their support, we're able to bring this presentation to you at no cost. However, there are no continuing education credits available today. This webinar will be recorded and posted to our ACHF Aetna Wellbeing Project's website, the link to which will be posted in the chat shortly. Additionally, if you have questions following today's webinar or about the project more generally, please feel free to reach out to Alex Phelan at aphelan@acha.org. This information will also be available in the chat and on the slide deck. Today, we'll have an opportunity to hear from two speakers on the Foundation's ongoing project on campus well-being supported by Aetna Student Health. Today's speakers will describe how the understanding of well-being is shifting on college campuses and how a newly developed whole campus survey tool on emotional well-being can help. After our speakers share their perspectives with us, there'll be time for Q&A at the end. I encourage you to use the Q&A panel at the bottom of the screen if you have a question anytime during the presentation. Please do not use the chat for that purpose. We will try to get to as many questions as time allows. If we don't get to your question, again, please feel free to reach out to Alex Phelan. So before we get started, we're going to do a quick poll of the audience to give the speakers a sense of the audience's perspective. In a moment, you'll see a poll that comes up. And what we'd like to know is, what do you see as the biggest opportunity to improve emotional well-being on your campus? This includes staff, student, and faculty. Going to give it another 5 to 10 seconds. Please take time to answer the poll question. Great. And here are the results. Wow, emotional well-being as an institutional priority, 44%. And then next is 21% ability to feel connected to the campus community. And then coming in third, tools and managing stress. And then having a strong sense of, loneliness, depression, and anxiety. And then having a strong sense of purpose and meaning. Excellent. Thank you very much for that. Now, I am delighted to welcome our speakers. Dr. Wendy Shanahan-Richards is the Chief Medical Officer at Aetna Student Health. Dr. Richards practices family medicine for over 10 years and was driven by passion for and committed to improving the health of people. During the past 22 years, Dr. Richards has held physician's executive positions in healthcare systems and has served in leadership roles for several large national healthcare payer organizations. In her current role with Aetna Student Health, Dr. Richards is responsible for ensuring that that the products, tools, and practices of Aetna Student Health meet the clinical needs of colleges, universities, and students. A key component of Dr. Richards' role is developing and growing strong partnerships with the clinical leaders of client and industry organizations and collaborate with them to achieve a positive impact on the health and well-being of health plan members. Dr. Richards received a Doctor of Medicine degree from the University of Chicago, a Master of Business Administration degree from the Benedictine University, and is certified by the American Board of Family Medicine and is designated a Fellow of the American Academy of Family Physicians. Dr. Richards is also certified by and designated a Fellow of the American Board of Quality Assurance and Utilization Review Physicians and is a surveyor for the National Committee for Quality Assurance. She is on the adjunct faculty of DePaul University, Chicago, where she developed and taught courses in healthcare administration and health information technology and analytics. James Larcus, MA, NBC-HWC, serves as a project manager for strategic initiatives at the Health and Counseling Center at the University of Denver. In addition, he serves as an affiliate faculty member in the Wellness Coaching Minor at the Metropolitan State University in Denver. In both of these roles, he is committed to cultivating an environment that supports student success and fosters holistic well-being. He has authored 6 white papers, book chapters, or peer-reviewed journals, articles, along with over 40 state, regional, or national presentation as it relates to well-being. James stays diligent in intersecting national and higher education trends related to well-being practices and develops and consults on community-based strategies within university contexts. He has overseen programs that have been awarded national and state innovative program awards and has been named a rising star and emerging outstanding professional in wellness by leading higher education organizations. With that, I am going to hand it over to Dr. Shanahan-Richards.
Well, thank you, Kim, and good afternoon, everyone. On behalf of Aetna Student Health and our president, Jin Oka, I am pleased to have the opportunity to speak with you today and to join my colleague, James Larcus, to provide an overview of a very interesting project called Measuring Emotional Well-Being, Taking a Whole Campus Approach. I will start with a bit of history to help illustrate the path to the topic we will present today. If we can go to, we're on the next slide, okay. So just a little bit about the two organizations. Aetna Student Health has a very strong commitment to well-being. Over the past few years, our organization and the American College Health Foundation have collaborated on various initiatives. I would like to tell you a little bit about each organization. Aetna, a CVS health company, is committed to providing individuals, students, healthcare professionals, producers, and others with innovative benefits, products, and services. The mission of the American College Health Foundation is to promote, improve, and advance the health, well-being, and overall success of college students. Aetna Student Health provides medical insurance for students enrolled in colleges and universities throughout the United States and has been doing so for almost 40 years. We recognize the importance of supporting the well-being of students, faculty, and staff at institutions of higher education, and we have been fully engaged in this endeavor. So we can go to the next slide, please. Thank you. In October 2019, during the ACHA Leadership and Innovation Summit, we shared the results of a research study called Framing Well-Being in a College Campus Setting. The study, a collaboration between Aetna and the ACHF, culminated in a published white paper, which is currently available on the ACHA-ACHF website. This was a 9-month exploratory study with a focus on understanding the framework and models of well-being programs currently in place on college campuses. The participants consisted of 10 schools that varied in size, location, and several other attributes, such as public institutions or private institutions. The research methodology included key informant interviews, focus groups, and supporting documentation provided to our team by a number of the study participants. The study included schools with well-being programs focused on students, which we called student serving models, well-being programs focused on employees, faculty and staff, called employee serving models, and some of the programs were combined student-employee well-being programs called hybrid models, where all well-being initiatives were coordinated out of one centralized functional area on campus. And if we could move to the next slide. The 5 key findings from Framing Well-Being in a College Campus Setting were: 1, there was no widely accepted definition of well-being. Secondly, no standard approach to conceptualize, practice, or adopt well-being. Also, thirdly, engagement varies and is impacted by institutional philosophy. And health disparities are being addressed in many of the well-being initiatives. And finally, the majority of institutions were not measuring or evaluating the impact of their well-being efforts. During the Leadership and Innovation Summit, we received very, very valuable feedback and insight from the participants, and they told us a number of things, 2 which really led to where we are now with in terms of measuring emotional well-being. And those 2 items that they talked about and very, very helpful information were measuring the impact of their well-being programs on campus was very important from several standpoints. And secondly, they would like to have the ability to access a validated measurement tool, which many of them did not have access to. So based on this, the team decided, moving forward, another initiative that we think would be very helpful would be to support the schools in effectively measuring the impact of their well-being programming. So we decided to work together to develop a research-based tool to help schools measure emotional well-being with a validated instrument. So I am now going to pass the baton to James Larcus, who will provide an overview of the project, Measuring Emotional Well-Being, Taking a Whole Campus Approach. James?
Thank you so much, Wendy, and for that context. And I'm excited to be engaging with you all in this digital format to talk about this important topic. But before we do that, we kind of want to build off of a similar question that we asked in the beginning, poll question, which we appreciate your responses. And we're going to put up another poll question here that will help inform some of the research behind where we are and how we've come to the place we are today. So there's a second poll question. If you could take your time to fill that out, we will jump back in a second. Take about 10 or 15 more seconds. All right, so thank you all for filling that out. As we can see, some similar overlap between both the first responses and the second responses. So our most common response here is the institutional culture. I know that's a pretty vague term, but I'd be curious to hear if you have any other thoughts about what that means, so throw that into the chat. But additionally, our second rated here is community and belonging, followed by, second is actually coping and stress, and then community and belonging. So thank you for filling out that. You'll see these terms as part of the research study here in the future, but appreciate you taking that poll for us today. All righty. So as Dr. Wendy has sort of shared, we have sort of evolved from this initial white paper of framing well-being in a college campus setting to now thinking about how can we measure the emotional well-being in particular, knowing that that is a really critical factor as it pertains to sort of the success and thriving of our communities. So I'm going to reiterate some key takeaways that we had from that first white paper, as well as see how we use that information to build upon where we're currently at with our current measuring emotional well-being project. So as Dr. Wendy mentioned, there's no one definition, model, or measurement of well-being. That was a key sort of theme and takeaway that we heard. Most models that are out there really speaks to well-being as an individualized process. And as such, there is no sort of set standard definition that people sometimes use. Institution by institution might have a model or definition that they are currently using, but across the board, across the country, in those 10 institutions that we were able to contact and be a part of, there was no sort of set standard definition. So different schools use different definitions or no definition at all. They kind of used it more as a framework to say well-being is a priority, but there may not have been an official definition. Secondly, each institution is at a different place in establishing their own language around well-being, some being fairly advanced, some being maybe at the beginning initial stages of maybe pivoting and transitioning into a more well-being and a holistic approach to the way that they support their students, faculty, and their staff. Additionally, another major takeaway that we had was that we saw that the sort of innovative programs and where the field is moving is we're moving towards a systems approach to well-being. Many institutions that we surveyed in this initial paper are still primarily employing sort of a health education approach and health education strategies in order to sort of create that ripple effect for their campus community. And innovative institutions are integrating beyond just health education, but they're integrating practices and policies that work at a systems level and even beyond the walls of campus and into the local communities. So really thinking of it as an ecosystem or culture of well-being compared to individual health or wellness behaviors. And third, there are evolving efforts to better define and measure well-being, which is why we are here today. So a number of efforts emerging at our various institutions from this first white paper to better define and measure well-being through the lens of both policy, systems, physical spaces, as well as some core constructs and outcomes such as resilience, thriving, and belonging. So next slide, please. So to that last point, this project, and as Dr. Wendy shared, we wanted to really sort of take that first initial paper and that first exploratory study and to see if we can start defining and creating a validated tool that institutions across the country can use as it pertains to a really core construct that is emotional well-being. So within the project goals for this the current iteration of measuring emotional well-being, we had three. The first is to test processes and procedures for institution-wide survey administration with faculty, staff, and students on campus. Our second was to develop baseline cross-population data for participating campuses and in aggregate on the emotional well-being of faculty, staff, and students. And thirdly, we wanted to run statistical validation tests on the collected survey data to see if we can further advance and validate the current tool that we're utilizing that can be used more broadly within higher education institutions in the future. So as I said, this study really sought to build upon the findings that we just discussed from the Framing Wellbeing paper that came out in 2020. I see it's being sort of put there in the chat for you all if you have not had a chance to take a look. And the reason we focused on emotional well-being in particular is because it was found to be a key and core construct within the cross-section of campuses selected to participate in this study. And I would just sort of make a note that this was sort of identified before even COVID sort of hit, and knowing that that brought its own physical health challenges, but the mental health challenges we're seeing in our current college campuses. So this sort of was identified even before the COVID pandemic as something that maybe we needed to focus some more dedicated time and attention to. So our current sort of project and paper explores the phenomenon related to the inconsistent measurement of well-being initiatives across institutions of higher education. In an effort to address this gap in the research, this current study focuses on the development, implementation, and evaluation of a new survey focused on mental health and emotional well-being that was administered broadly to a cross-section of college and university students and employees, again, including students, faculty, and staff, so the whole sort of campus community. If we could go to the next slide, please. So similar to the first takeaway, we in the first paper, knowing that we had to have something to sort of work on, we didn't get into this too much, but if you read the first white paper, we utilized the CDC's definition of well-being just as a starting point to have those conversations with those 10 institutions. And similarly with this project, measuring emotional well-being, we wanted to at least have some sort of launching point and to have a sort of similar baseline of a definition or construct that not only our team, but also our institutions could provide as they're administering this survey. We came to this by reviewing the various literature as well as organizations, nonprofits that are really doing this work. And we came up and decided to sort of use the same definition, both for consistency, but also to see that it was sort of a nice baseline that a lot of institutions, campuses, and other organizations are using. So our first step was reviewing that literature. The second was coming up with this working definition that you can see here on the screen. So the CDC describes well-being as, at a minimum, the presence of positive emotions and moods, things such as contentment and happiness, as well as the absence of negative emotions, things such as depression and anxiety, satisfaction with life, fulfillment, and positive functioning. In simple terms, it is judging life positively and feeling good. So we use that sort of as a baseline definition for us as a group to sort of guide our work, as well as to dive a little bit deeper. The CDC also goes on to say that emotional well-being is a state in which children and adults manage emotions, set and achieve positive goals, feel empathy for others, establish and maintain positive relationships, and make responsible decisions. The core competencies for emotional well-being include self-management, social awareness, relationship skills, and responsible decision-making. Emotional well-being considers the mental, emotional, and social aspects of a person's life that fosters health by achieving a state of balance affected by both challenging and rewarding life events. So those are sort of the initial sort of thought process we had as a subject matter expert team in the work to create this sort of tool. And if we can go to the next slide, we'll kind of talk about the next steps and where we currently are. Thank you. So as you can see here on the screen, hopefully it's big enough for you all to sort of read. But our emotional well-being, building off the literature review, building off that definition I just read from the CDC, we started to think through and build our own sort of conceptual model of what emotional well-being is to help guide our survey development. So if you can see here on the screen, there's a couple core concepts that were both read in the definition and from the literature that will guide and be in this next iteration of the white paper, is that emotional well-being includes some of those domains that we just asked in our second domain, or our second poll question, sorry. So the first is the importance of community and belonging, and the sense of belonging. And I see some of you are sort of affirming that in the chat as it relates to institutional culture, as well as things that you're seeing from the first poll question. Additionally, emotional well-being in our conceptual model is some sort of combination of individual skills to both cope and to have stress management sort of capacities that students, faculty, and staff are able to use. Additionally, some of the research and what we've been reading is the importance of having meaning and purpose in life, and how that really guides our sense of self within the world, and the way we make sense of our emotional well-being. as well as the rising nature of subjective well-being tools that are out there within the field, really guiding and utilizing some of the core concepts there. But as you can see, there's sort of a larger side bullet that's not directly sort of encapsulated into the emotional well-being. But this really came from not only what you were putting into the chat, but our first framing well-being paper is the importance of the environment. So we wanted to, and this shift towards environmental factors. So we wanted to make sure and include our own conceptual model that also included that sort of institutional culture, the campus environment for emotional well-being, and to see if we can measure some of those environmental factors as it relates to individual and collective emotional well-being on campuses. Next slide, please. So what do we do from there? As you can see, this is sort of built out. The next sort of steps and phases that we took beyond creating our own conceptual model was to review existing surveys and literature and scales and items that are associated with each of these sort of core concepts and latent variables that we came up with. So it took a couple months. I'm looking at Kim here for the amount of work we went through to not only define, but also to sift through all the related and validated measures that are associated with each of these sort of constructs, and to see how it fit in and mapped into where were we thinking as a group, but where are we also hearing from the members in colleges and university campuses as it relates to faculty, staff, and student emotional well-being. So as you can see, within each of these, we sort of built out those sort of core concepts into some more latent variables. The community and belonging has a couple of core dimensions that we found and saw that we wanted to sort of measure and include within this project, which included social, sorry, it's small, my students, social connectedness and belonging in particular, confidence, safety, and trust. Was something that really came out through it. And this, I think, speaks a little bit to the institutional culture as well. So there's a little bit of overlap. As it pertains to coping and stress management, there's a lot of research and a lot of buzz around how do we make more resilient and stress management tools, techniques, and skills. And there's a lot of research behind that, as well as a lot of validated measures. Flexibility and adaptability is seen as something that kind of came through it. It could be very much so tied to the resilient factor. But we saw that as something that we wanted to explore, as well as you'll see not only the presence of good things, but in that definition of the CDC is also the absence of negative things. So we had anxiety, and we'll have some other measures at the bottom that sort of shows not only the presence of positive things, but also the absence of some of these negative health behaviors or outcomes that we see related to this topic. Subjective well-being also went back to resilience and stress management, flexibility and adaptability, the anxiety, but also included things related to meaning and purpose as well, which you can see. I see that I just skipped that third bubble, but purpose and meaning, there's a lot going on there about like sort of meaning in life, satisfaction in life, post-traumatic growth, things of that nature. So we really combed through the research as a way to sort of map all of these different ideas that we came up with in our conceptual model to build out sort of our survey tool that we'll be talking about here in a bit. Next slide, please. Just so to give you a good sense, so after all that work, we've distilled it down to this slide, basically is sort of a snapshot of where we've come to as a group. So you can see at the top in these bubbles are sort of the main domains we started with, as well as what did we see as maybe the particular research and validated tools that are out there that we could potentially draw from to create a really comprehensive emotional well-being tool for our campus populations. So for the community and belonging domain, you can see the surveys that we used there. We used the well-being process. We used the Diener flourishing scale. We used some questions from the VIA character strengths assessment, the mental health continuum short form by Corey Keyes, as well as drawing upon the work that is already happening within higher education space and from one of our subject matter experts at Wake Forest. We're using some of the questions from the well-being assessment at Wake Forest. For coping and stress management, we took questions from the well-being process. For purpose and meaning, we looked to some of the work that's happening at Claremont, and we used the Claremont purpose scale, as well as then moving on to subjective well-being. We use the Diener satisfaction with life scale, as well as questions that are currently in the well-being assessment at Wake Forest. And then to get the environment, we do have, as I said, a sort of a robust group, and we have someone who really focuses on faculty and staff well-being on campus. And so for the campus environment, we really draw upon the work that's happening through the Guarding Minds at Work survey tool. So that gives you a quick little snapshot of sort of what did we do? How did we distill down all that research and literature into the tool that we currently administered to a handful of institutions this fall as a way in spring to be able to pilot and give you some results here coming up. If we can go to the next slide, please. And I wanted to give you a little bit of a like closer in-depth look of where we kind of landed. So this is just one of those constructs and some of the questions that we used. So for the subjective well-being, I mentioned that we use the Diener Satisfaction with Life scale. So what you can see, and this will be coming in a forthcoming sort of technical paper, not only a white paper, but a technical white paper around sort of the survey tool itself, its validity and how we came up with the idea. But here you can see some of the questions that we use to measure subjective well-being for that one subconstruct on our tool that we are using. So here below are 5 statements that you may agree or disagree with. Using the scale below, indicate your agreement with each of the following items by selecting a response to each statement. So there you can see 5 different statements. This is what has been validated by Diener and his colleagues as a tool. For us, this connected to the subconstruct of life satisfaction and happiness. And as you can see, we actually use this scale in full. There are no changes that we had made. There are some tools that, based on a college and university context, either we took out particular questions and or changed some of the wording of the questions to make sure that it fit more in line with our unique population. So this is just a quick little snapshot and highlight of what it looked like for one of those domains. If we go to the next slide, it's just another example of what we use for subjective well-being from the well-being assessment from Wake Forest. So we pulled out some of the questions that they utilized there as a way to sort of build upon what the work that's already been done. So I'm not going to read over those too much, but as you can see, and again, forthcoming in a technical white paper, just some of the constructs and some of the flourishing and sort of emotional well-being tools that we pulled from. We can go to the next slide. All right, so that's all the theory. That's all the maybe fun stuff, maybe not so fun stuff, depending on where you sit. It's fun for me. That's sort of my contribution to this group, was really diving into sort of the literature and finding out where we could kind of come up with this tool. And with not only Kim, but a handful of others that are on our team, we came up with our tool and we actually administered it. And so I wanted to give you a quick snapshot of where we currently are within the process. We had administered this assessment, and we gave it to 6 institutions who self-selected into the study. So last time we had 10, this time we had 6. Just to give you some demographics of where these schools are, we have 3 Midwestern college and universities. We had 1 New England, 1 Mid-Atlantic, and 1 in the Southwest. All 6 of these schools surveyed all of those sort of groups, so faculty, students, and staff. One school did not just sort of select and say, I just want to do this for students, we just want to do it for staff. We really wanted to be a comprehensive approach and a systems-based approach to what does well-being as a whole, but emotional well-being in particular, look like on campus. We have, it looks like, just under 7,000 responses from those 6 institutions. That gives us an average of just over 1,100 per institution and per school. And one thing that we thought was interesting and kind of curious as we sort of get our data back and sort of get through and sift through the data is that some schools surveyed multiple campuses. We have a couple of schools that have multi-campus sort of systems and or just that's how the institution is structured. So they were able to administer this to, for instance, their law and health sciences campuses, which might be separate than their quote unquote main campus. So right now we have gone through those first initial stages of kind of coming up with our own conceptual model, our own sort of latent variables, figuring out what tools we wanted to use to construct this. And then we've actually administered the tool in the past couple months. And we are now in the process of sort of delineating and finding out what came from this data to inform the next iteration of this project. So that's just to give you a sense of where we've been and where we might be headed. You can go to the next slide, please. Oh, I guess that is the last. I kind of stole a little bit of Wendy's thunder, but I wanted to kind of give it back to Wendy a little bit here to talk about sort of her insights on where we've been, kind of having that higher level view, and maybe where we might take this now that we have some of this initial data coming in.
Well, thank you, James. So over the past half hour or so, we have provided an overview of the collaborative path that Aetna Student Health and the American College of Health Foundation have traveled over the past 2 years. It's been an honor for me to work with such talented individuals as James and Kim and others on the team, so I appreciate that. The work really started as a way to gain an understanding of the ways in which colleges and universities approach understanding and supporting the well-being needs of their students, faculty, and staff. And now, more recently, to use our collective efforts to develop a survey tool that is a validated tool to further support our schools and their students and faculty and staff in this realm. So as James says, we have more information to share in the coming months as the results from the survey and this initial pilot are reviewed and analyzed, and the technical white paper is completed. And we're talking now and discussing about what next steps may be, based on the results that we have. But we know there will be more to come, more interesting and innovative information to share. And hopefully we'll be able to give you more information in the coming months. So now I'd like to pass the baton back to Kim, who will facilitate the Q&A portion of today's webinar. Kim?
Great. Thank you all so much for your insights and information. I'm going to go in the Q&A box and grab some questions. We do have one about the first white paper. Curious as to what the 10 institutions were that contributed to the first white paper. Is that something we have readily available, James?
I think we have that information. To my understanding, we were kind of keeping that information as sort of informatory, as an exploratory study. Each of these institutions, from my understanding, sort of self-selected, but didn't want to necessarily be identified. So we sort of de-identified that data as more of an exploratory. What are the themes that we're seeing? But we are able to provide, as we said, some of those larger demographic type things, but not specific institutions.
Great, great, thank you. We've had a couple questions about receiving copies of the slides or the presentation. And in the chat box and in our last slide, you'll see the link so that you can get the live recording. Oh, thank you. The live recording and the copies of the presentation. And so keep the questions coming. One here we have for Dr. Wendy. Why is the overall concept of well-being important to Aetna Student Health? Shouldn't ensuring student well-being be primarily the role of the school?
Well, thank you for the question. We, as I mentioned, we have been working with schools and with students for almost 4 years. And we recognize the importance of the various dimensions of well-being for not only students, but faculty and staff. And as the leader of the Aetna Student Health clinical team, on a daily basis, we speak with students who, are challenged with, many different things during, their time at school. And we provide this type of support, that we can, as the provider of health benefits. We work very closely with our schools to ensure that any resources that we can provide are in alignment with what the school's well-being strategy is, and along with, of course, the care that is provided within the campus health centers. So we feel that, it is paramount for us to support in any way we can the emotional and physical well-being of students as they make their way through, their years in college and graduate school and professional school. And so when the opportunity came about to partner with the ACHF on this really important initiative, it was really kind of right hand in hand with, our philosophy around, holistic care, and providing, holistic, benefit coverage for our students as well. So it was, again, a really kind of a great match with, our philosophy, the way we see things in Aetna Student Health, and the view of ACHF. So, we don't provide care, but we support, various aspects of healthcare for our students, and this was definitely one of the primary ones.
Great, thank you very much. Another question that has come in is, what would be the next iteration of the new tool if it's validated? James, are you comfortable with that?
Yeah, actually, I typed into the chat, but I think it's important to maybe address for the whole group. So yeah, we hope to get some of this data back, validate the tool, and to build upon it. The next iteration will be to administer it to more schools, to increase that N, and to see how this tool can improve to measure this really important construct for our campus populations. In addition, the next iteration, from my understanding, is also to maybe look at potential subgroups and to see if there are differences, maybe particularly on the student side, maybe with graduate students versus undergraduate students, or those who are in fraternities or those who are not, athletics. You can come up with a bunch of different, but we're really interested to see not only once the tool is validated, but maybe are there differences across our institution and across our culture within different student groups or different populations within some of our faculty and staff as well.
Great, thank you. Dr. Wendy, I have a question here for you. Does Aetna get access to personally identifiable data from the survey that could impact insurance rates? And the second part of the question is Aetna using the data in other ways to further its business model?
So we do not receive any individual student, faculty, or staff information from the survey. Any results that are shared are all aggregated results. So we do not have access to that information. And in terms, and so we don't have access to the information. So we're not using. We don't have access. We're not using the information, and we also do not have. Access to information from the survey tool or the results of the survey that would, impact our business model. As I think in terms of our business model, I really see it more as a philosophy to do whatever we can to support the well-being needs of our students.
Thank you. James, we have a question here is, where can one find the list of competencies highlighted in your deck?
Yeah, I think the best answer to that will be you'll have, I believe, access to this, both the recordings, so you'll be able to see those things. I'm also happy. I'm trying to watch and pay attention to sort of type some of those into the chat as well. But I think the worst case scenario, the contact information is being showed up there for Alex, and Alex could connect you to myself and or anyone else on the team to either give you that specifically or follow up with a conversation.
All right, great. And do we have plans to develop the tool to measure other dimensions of well-being just beyond emotional? For example, physical, mental, financial, etc., or even better, a fully integrated tool. Have we thought about that?
This is Wendy. I can say that our combined groups are, we're very ambitious. And when we were moving down the path from the initial study around framing well-being, to where we are now with measuring emotional well-being, we had a lot of discussions about what direction we could go from the learnings from our first endeavor. And as James said in his presentation, really, going in the direction of evaluating the tool and developing a tool around emotional well-being really rose to the top. But we continue to be very ambitious group, and we are definitely looking toward the future to evolve and expand upon the current survey. And James, feel free to add.
Yeah, I would say there's definitely interest, obviously from this group, but I think from our group as well. We know that this is only one subcomponent of the larger picture, and there's a lot of good work happening in those other areas as well. I think we just sort of identified maybe right now that emotional is where we wanted to focus. But as we know, there's no set definition, but what was a theme from the first paper is just how interconnected each of these domains are to one another. So in one way is measuring one, you're sort of getting an insight into the other, but it's not necessarily exactly the same. So I think there is some utility to maybe exploring some of those other topical domains as well. So great question. And I'll maybe just jump in and add a little bit of note here. I'm seeing how does this interact with NCHA? Obviously, it's sort of based from some of the same groups with the American College Health Association and the foundation. I can say from my perspective at the University of Denver, we're utilizing this as a complementary and additive tool. I think the NCHA is a nice comprehensive tool that has also shifted in sort of the next iteration of that tool. But for the longest time, we use that as benchmark data just on related health behaviors as it spanned from putting on a seatbelt to your alcohol and drug consumption. But knowing that that's shifted, we also know that this well-being tool in the first paper is really trying to measure the positive capacities, not just the absence of negative, maybe health behaviors, but we're utilizing it as another tool that we can use with administration to sort of paint the picture of where we are and where our students are at and some of the core topics that we're hearing from our various populations on campus. So we're seeing it as a complementary and additive, at least from my view here at the University of Denver.
Great. This is a great question. I think that both of you can take a stab at. Oops, it just moved. Can you share insights with us regarding ways you envision the results could inform high-level administration decisions, policy, and institutional changes?
Well, I can start, James, if it's okay with you.
Yep.
So when I mentioned the October 2019 ACHA Leadership and Development Conference, and where we presented the preliminary results and then the final results of the initial study around framing well-being. And one of the things that we heard from, again, a number of our participants at that forum was that in order to really get solid commitment and buy-in from our administration, we have to be able to show some sort of results for the programming that we offer. And we need to be able to measure before and after. We need to be able to help our administration understand the value of what we are providing to our students and faculty and staff. And that is why of the kind of 5 primary findings from the initial study, we went down the path of measurement. It was one of the main reasons why we went in that direction, because we heard loud and clear that there really wasn't something widely available that could help the schools do this.
I'll leave that where it is. I think that was a great answer. Thank you.
All right. Another question is, does the survey look at health risk behaviors such as substance abuse?
Currently, this tool does not. I think that's where some of the where you can have it complementary and additive to other measures you're doing, whether it be the NCHA or others. Going back, if we were to kind of go into slides, it's really measuring some of those core concepts as it relates to community and belonging, to resilience and stress management, some of those sort of core ideas that we were able to distill from the literature. It's measuring more of that, more so than it is specific sort of health behaviors related to things such as substance use.
Great. Are the pilot study schools able to use the data collected to report on the EWB to their populations? Is the pilot study data considered validated data?
I defer that question more so to Alex. If you can maybe type that in. But my understanding is that we're in the process of validating it. So although we're using validated tools, all these things hanging together, we're not sure exactly how it is until we do that technical paper. But I think that each of the participating schools does get sort of an aggregated data set to know where their campus is as it pertains to this initial iteration.
Great, that was my understanding also. Do you know if this survey is compatible with some of the most common EHRs being used at colleges today? Or would you recommend utilizing this tool using other applications?
That's a great question. And I feel like especially with maybe institutions, if you're an integrated model where your health system is connected to maybe your health education wellness offices, this is a question that will continue to come up. My understanding, I think it was just in Qualtrics is what we were utilizing for this. Whether or not it's compatible with some of the larger EHRs, that's not been the major focus, but could definitely inform us in the future as a group. Should this tool get validated and move forward, that integrating it into those systems might be helpful.
Then I have a foundation question. So there's no formal campus emotional well-being recommendation today from the foundation. Is this correct? And I believe Alex can probably answer you directly in the chat regarding that.
Yeah, and I would add is we're kind of in the conceptual stage, and we've sort of piloted the instrument. We hope to have more, and I think in the forthcoming papers, both technical and white paper, we hope to have some of those maybe recommendations or insights similar to what we had from the first. But currently, right now, our team is in the process of distilling that information. So no practical takeaways for this is what you should do, if you want to say that with air quotes, for your emotional well-being on campus. More so the need to measure and have sort of a consistent sort of baseline for this particular topic, and hoping that this project can help advance the efforts that you're all doing in your respective campuses.
Since this tool is looking at more aspects of well-being and possible earlier interventions, what type of early interventions do you think this could serve? For example, anxiety tools you intervene for mental health, possible medications, etc.
Sorry, I'm just making sure I'm getting the question.
Right, yeah, I'm rereading it also.
I think the spirit of that question is something I'm focused on. As someone who has been trained non-clinically, has been coming up through more of the health education wellness route. Anytime we can move more upstream, the better. And I think if we can have a tool such as this help inform some of those strategies, that'll be super helpful. In terms of what those exactly look like right now, I don't have anything off the top of mind, but I do know that there are a variety of best practices and really great work that probably each of you are doing at your institution that can hopefully serve that sort of pipeline. I think the spirit of how well-being has sort of launched and blossomed in the last couple of years is to show the need for us to not only have a duty and a responsibility as institutions to be reactive to the crisis and or risk that inherently will be a part of our college campus populations, but also the duty and responsibility to really develop our students, faculty, and staff holistically. So I think we're, as an institution, as a field, maybe shifting in that direction, as well as those environmental factors, really showing how important those are. But that would be the first place in my mind that I'm hoping to utilize some of this data and information, is how can we inform the environment and the policies and procedures that can hopefully be a more upstream approach. It's not really necessarily an individual intervention, but more an environmental intervention for the way in which we support and create a community where all people have the opportunity to flourish and to thrive.
Fantastic. We have an attendee that would like to know if our study addresses inequality as it relates to well-being, especially racial, gender, and etc.
We try to incorporate some of those into the particularly the environmental sort of questions as it relates to culture, whether it's a welcoming or not welcoming type environment. But that's really the shift that I see. I think for me as a practitioner and where I'm seeing sort of this paper, it's not necessarily something I've shared with the group per se, but I'll share it here now, is that we saw how in the beginning there's a lot of health education strategies. And I feel like as a field, we've really focused on education and empowerment. Sort of the 2 E's is really what's guided our work. And as we advance and take this next step, both where the field is, and I think we're being called to action with the dual pandemics we faced with both the health pandemic of COVID and our racial pandemic in our country, is that we're going to change those 2 E's from the education and empowerment to more the equity into the environment. And I feel like this tool will help maybe craft that narrative. And we do have some questions that I think relate to some of that, but obviously more work to be done. And also knowing you can use other sort of surveys and tools maybe that are happening on your campus, whether it be a campus climate survey or other things like that to help continue to paint that picture in a more holistic way. But I think it's a really important question that's posed.
Yeah, I agree. We have another question that wants to know if we're looking at academic outcomes.
Not specifically within this tool. The ways in which, again, that I'm hoping to utilize this, and I know it'll be a different bureaucratic challenge than other campuses than maybe some. But are there ways that you can connect existing data sets to some of those things that I know administrators care about, which is academic performance, academic success, retention, things of that nature? So questions to consider if you were to sort of use this as a tool is how can you maybe connect it to some of your other systems, whether it be Banner, et cetera, whether it be with an ID number, students who take this as it relates to grades and other academic outcomes, but as it sits as its own individual tool, no, there are no academic outcomes that are associated or questions. Some of the questions relate to how is this impacting some of the things that are going on, but we don't measure in particular like GPA or some of these other things as part of it. It's more to measure the emotional well-being as a construct and as an idea.
Fabulous. We have a question here I'm not sure we can answer at this time, but we could get back to you, is how much has this project cost so far? I think that is something, I'm thinking that's something we're going to have to get back to you on. There are a couple questions about next steps, and I'm not ignoring those. It's going to be part of our closing comments. I think we're right at time. I want to respect everyone's time because I know we're going from Zoom to Zoom, and it's nice to have a minute to stretch before your next call. So I want to thank both of our wonderful speakers today. We know how busy you are, and we appreciate the time you took to share your expertise with us. And to our audience, please stay tuned for information on forthcoming white papers, as well as the administration of the Emotional Wellbeing Survey Tool for the fall of 2021 semester. So thank you very much for coming today. Be well. Keep an ear out for the new information. We appreciate it.
Thank you all.
Thank you.